Osteoarthritis is the most common problem the elderly face. It is commonest. Why? Because it is actually a misnomer. It is not osteoarthritis, it is osteoarthrosis, which means inflammation and degeneration of the joints. It not only involves the joints, it also involves the synovial membrane around the joint capsule, the ligaments, the muscles, and most importantly, the cartilage between the two joint surfaces. Now, what are the causes? Why could you have got osteoarthritis? Commonest being old age, degenerative disorder here, right? Second, it may be in your family. You may have had a family history of it. It also is because of obesity. When you are overweight, the entire weight tends to transmit on your knees and through your knees towards the floor. Also, there may be a history of immobilization. You may have had a fracture, it may have been immobilized for too long. Neuropathy, a number of it. It could also be because of your occupation. If you are supposed to sit for too long, or if you have prolonged standing hours, that can also affect your joint. These were the common causes. Coming on to the symptoms. How would you come to know if you've got arthritis or not? You will experience the pain in the initial few days, followed by a little bit of loss in the muscle function. You will not be able to do a lot of works like bending down, like cross-sitting. Whenever you take the stairs, whenever you descend down the staircase, you will experience pain. All these kind of problems are going to get faced. There will be swelling, there will be edema around your joint, and you will experience a lot of weakness around the joint area. The pain will tend to sometimes also radiate down your calf area. The most common stretching exercises I would like to tell you, which you can do at home for osteoarthritis to help you, are just take a small towel, roll it up nicely, make a thick towel which is almost this thick, put it under the contour of your knees, lie down straight with your knees absolutely straight, keeping the towel or a thick pillow under your knees. Press down upon the pillow with both your knees, keeping your legs absolutely straight, and straighten your ankle and toes. Pull them towards your head. Hold the position, keep the contraction on, retain it for 5 seconds and then let it loose. Repeat it for 10 times. The next exercise, similar fashion may, just take this towel roll, put it under the ankle area, just where the ankle joint is formed. Again, in the similar fashion, you're supposed to press down upon the pillow or the towel roll and pull the ankle and toes towards your head. Retain the press, retain the contraction that is, for 5 consecutive seconds and then relax. Repeat it for another 10 times. Another very easy exercise is you're supposed to lie straight on the bed, elevate your leg straight, absolutely keeping your knee straight and hip, and take it up to around 30 degrees. When you elevate it, pull your ankle and toe towards your head. Retain the contraction for around 5 seconds and then relax. Again, repeat this exercise for 10 times. These 3 basic exercises, along with some hot water fermentation 3 times a day, 10 to 15 minutes is good enough time for hot water fermentation. These will keep osteoarthritis at bay, and certain common precautions you need to observe. Do not lift any weight, try to lose weight, absorb a lot of sunlight, go for a leisure walk wearing your kegs on a firm surface and not a wobbly surface. Do not sit down on your haunches, do not sit in a cross-legged position, try to avoid an Indian toilet, use a Western commode only, and try to avoid taking up stairs. And remember, lifting up children also comes under weight. Certain common precautions, you can avoid osteoarthritis, practice at home, and if there is anything at all that you need to, if it is concerning you, just visit your physiotherapist for a better supervised treatment.